How to own your public health semester and set yourself up for what's next. Hey everyone, Omari Richins here, founder and CEO of the Public Health Millennial, where we help you learn, navigate, and transform your public health journey. Be sure to hit that subscribe button and hit the like. Start with a vision, not just a syllabus. Before the emails pile up and the discussion boards flood your inbox, pause. Ask yourself this: what do I want to look back on and see I built this semester or this year? Having a clear vision isn't about knowing exactly what your future job will be. It's about setting a direction. A semester of intention beats a semester of survival. Whether you're just starting your MPH, entering your second year, or facing graduation, this time can either pass you by or become your launchpad. I entered my MPH program not knowing one thing about public health. Later, through learning, developing a vision, and applying myself, I was able to gain the experiences that were vital for me to secure my community health fellowship after my MPH. Knowing what you want to do so you can develop those skills and experiences is essential to set yourself up for success. Write down: 1. What would success look like in 4 months? 2. What kind of work energizes me? And 3, where do I want to grow? This is your compass. Now let's build the map. The myth: it'll all work out later. It's tempting to believe that public health careers magically fall into place. You take your classes, go to conferences, finish your practicum, maybe do a capstone, and then a great job will just appear. Poof. In reality, most people find themselves panicked in their final year, scrambling to update their resume and their LinkedIn profiles, with no clear idea of what opportunities they're even looking for. Here's the truth: professors rarely have the bandwidth to coach you through the job market. Career services may not specialize in public health pathways. Opportunities go to those who start before they feel ready. The earlier you start thinking and acting like a public health professional, the smoother your transition will be. Think of your semester as a career incubator. School isn't just about grades, it's your training ground for what's next. The opportunities, the jobs, the fellowships, all these things come out of your training in school. This semester and year is a lab test for your interest. Grow your skills and build your story to set you apart. Here's how: explore, join events, follow organizations that interest you, attend webinars, read and dissect policy briefs that are out there. Build, learn or deepen a skill you'll need post graduation. Look at roles you want to have and work backwards on what's important skills and experiences that you need. Reflect, journal about what excites you, what's draining you, and what work feels meaningful. You're not just earning credits, you're building momentum for your career. Here's the PACE framework. Set 4 realistic, game changing goals for your year or your semester. You don't need to overhaul your life, just focus on 4 targets that move you forward. Use the PACE framework to help you succeed. PACE: P standing for practicum or experience, A, acquire a skill, C, connect with people, and E, elevate your story. So 1, practicum or experience. Secure one experience. Gain real world exposure. Don't wait for it to find you, whether formal or informal. Experience helps you build credibility and discover what you enjoy and don't. Look for ways to apply what you're learning in class. Ideas for opportunities here are: apply for internships or fellowships, volunteer with community organizations addressing health inequities, join research with a professor or community based participatory study, run your own micro project, do a survey, a blog, some outreach, run focus groups. You can do this. You have the skill sets. Even unpaid work or short term projects can count if you reflect on what you've learned and add it to your resume or portfolio. 2, acquire a skill. Build one skill. Choose one meaningful skill to build this semester. Don't try to learn everything. Choose a skill that's relevant to your goals and build around it with intention. Some examples of public health skills to build could be in data, Excel, SAS, R, Tableau, GIS; for communication, grant writing, plain language writing using Canva; community practice, doing facilitation, interviewing, program design, and focus groups. And on strategy, you can do things like evaluation, implementation science, or policy and advocacy. Set a smart goal around this. For example, complete one Tableau course and build a mini dashboard by November. 3. Connect with people. Connect with 3 people. Relationships build careers, not just resumes. Your network will open more doors for you than your GPA will. Focus on genuine connections, not transactional ones. Ways to build relationships: go to office hours, even if you don't have questions. Set up one on ones with alumni or professionals. Start with LinkedIn or school directories. Attend conferences, webinars, or virtual events and follow up with the attendees and, more importantly, maybe even the speakers. Collaborate with classmates and share opportunities. After connecting, always send a thank you and keep people updated on your progress. It helps build long term trust. 4. Elevate your story. Improve one part of your public health story. Your resume, LinkedIn, and mindset should reflect where you're headed, not just where you've been. Learn to tell your story with clarity and confidence, from elevator pitches to just general conversations. Tangible ways that you can elevate your story are refreshing your resume and tailoring it to a specific job or internship, writing a compelling LinkedIn About section that shows your values and goals. Practice a 30-second elevator pitch to use at an event or in interviews. Create a wins folder or journal to track your impact this semester. You don't have to have it all figured out, but you do have to show why you care and what direction you're working towards. You don't need to master all 4 of these. Pick 1 or 2 pace areas to focus on this semester. Let those shape your plan, your energy, and your growth. You'll be surprised at what you can build with focused intention. Don't wait for the system to save you. You're not behind. Many public health programs don't equip students well for today's workforce realities. And often students don't engage with career services until it's too late in their journey. They may not teach practical skills like resume writing or digital communication, lack intentional mentorship pipelines, overemphasize academic paths over community based work. So here's what to do instead: create your own advisory board. 3 to 5 people, just 3 to 5 people, you check in with for honest advice. Use people that you respect and will hold you to high standards and hold you accountable to the things that you say. Join communities like Sisters in Public Health, Brothers in Public Health, or the Public Health Millennial Collective, linked below. Places where you can ask questions, gain exposure, and feel less alone. Treat job searching like a course or a job. Block time each week to research roles, to network, or to polish up your materials. You are not helpless. You are building your own ecosystem of support. This takes time. Give yourself grace. Just make sure to take some action. Start small. Tiny steps, big results. Feeling overwhelmed? Start with just 15 minutes a week. Try this to not get overwhelmed. Save one job or internship and study what they're looking for. Message one alum or professional for an informational conversation. Improve one resume bullet to highlight your impact. Listen to one Public Health Careers podcast episode to learn more about career interest. Micro actions lead to macro change. Consistency is better than intensity. Stay consistent. What if you're in your final year? Don't panic, but don't wait either. Your final school year is go time. The goal is not perfection, it's just progress. Here are 4 essential moves to take. 1. Clarify. What roles or sectors excite you? Be specific. 2. Align. Find ways to align your experiences with roles that excite you. 3. Position. Update your resume and LinkedIn to tell the right story. And 4. Connect. Start reaching out before you're ready to apply. Make connections today. When I entered the final year of my MPH program, I had no clue what came next, but I started learning about roles that interested me and started applying to them. Weeks without responses, or none at all, doubting whether I even belonged in public health. But when I took a step back to reflect and plan, everything shifted. I was able to see my own experiences painted a path forward for me. My skills in community health needs assessment, program evaluation, and survey development proved essential. My dedication to setting job alerts from Google proved essential. You don't need to land your forever job, just one that is aligned for your next step. Public health is still worth it. Yes, it might feel like it's hard right now. Yes, the workforce is shifting, but that's exactly why we need you. We need creative thinkers, community rooted leaders, and professionals who believe in equity, justice, and health for all. You're not entering a dying field, you're entering one in need of transformation, and you are part of that change. Take your first step. You don't have to do it all today, but you do have to start. Ask yourself, what's one small step I can take this week that future me will thank me for? Then take it. And know you're not alone in this journey. If you found this helpful, hit that like button, share this with someone who gets some value from it, tap into the community link below. Very excited to be relaunching that. Hope to see you all soon. Have a good one, everyone. Bye bye.